Juliana will cover that, the school portion.
Yeah, I live in an area that, like near Pearson Ford, for example, where they moved it out of there. And I'm thinking, why don't they put a park in there or something? There's no parks in the area for the children to play in.
Right.
And, I think, just throwing it out there, it's been vacant now for over a year. I don't know if anybody's purchased the land, but, why don't they turn that into a park?
And that's what we're trying to empower community residents to advocate for themselves, to get involved in the community plan updates, to become knowledgeable of that whole process. Because community residents have such a large voice.
Yeah, how do we do that, though? How do we?
Do you live in the neighborhood by Pearson Ford? Do you live in the neighborhood?
I do.
Talk to me afterwards. I'd like to talk to you about that.
Okay.
Yeah, because I've been
This is one way how you can get started.
It's just like vacant, and I'm
Right.
like, what are they gonna put there? Why don't they put crap out?
You?
I'm just wondering about, 16 million, it sounds like a lot of money. Who decides how that gets distributed? Who gets to use it? And who checks to make sure that it's really being used for what it's supposed to be used for?
Well, with this funding, it is being highly scrutinized. I mean, you have to know exactly where every dollar is going. And the county, along with community partners, submitted a proposal to CDC, and we're based off of looking at obesity, looking at nutrition activities, and they had requirements as part of that grant. The way the funding goes, you have to only go from government to government. So you can't go from the county to community-based organization. It has to go to another government entity. And what will happen is that we will be working with certain government entities who will then potentially subcontract with other agencies and put out MOUs with those agencies to help send out the implementing of the activities. And so I know schools will be involved. I know a lot of community government agencies will be involved in making sure that part of the community plan updates, how can they redesign their areas. They're looking at nutrition, they're looking at obesity, they're looking at bringing in community food gardens and farmers markets into areas. And the efforts have to be countywide, so these will be countywide efforts that will be happening. It's only for 2 years as well. So whatever they're doing has to be sustainable after those 2 years.
ABC just did a series with Jamie Oliver's Food Revolution, which I think is a model to make changes. Because if the government is going to have the same dietary guidelines in the schools, I don't care how much money you have, unless they're going to change those guidelines, which are outmoded. Right. How are you going to make changes? So I'm saying the thing is, you've got, to me, seemingly a perfect model as to what needs to be implemented. In other words, we don't need to remake the wheel. He showed you what needs to be done. Right. So my question is some of that money going to be directed towards, okay, we're going to have to change the diet, the school menu. Forget this idea of bringing in chocolate milk, strawberry milk, and junk food. And the thing is are there going to be people that are going to be whose feet will be held to the fire saying, okay, we need to implement these changes because we want these kids to live and have a healthy environment and eat food.
Yeah, and that's part of the working with the schools, looking at their menus and the foods that they're having, also looking at physical activity as well. So that both of those areas will be covered in this funding.
Getting rid of those soda machines and all the junk stuff that those kids have access to.
Right. And even in our county building, sometimes I'm a little sad when I want a little sweet, but they change our vending machines so that everything is more healthy. And I know in some of the schools they have done that as well. Yeah. They're looking at switching out the sodas and the cookies and chips and bringing in like crackers and things like that.
Well, I worked at a high school in Chula Vista, and for sure they got rid of the soda machines, but they brought in Gatorade and all the other high fructose drinks, and they put in baked potato chips, and they get creative on the little Oreos and how they word it. So they're still getting the junk, it's just in a different label and creative advertising. You know? And they still have the pizza stands at lunchtime, so the kids are going for pizza.
You're talking about working with planning departments, I think, and updating general plans. Can you let us know which ways you've been able to be successful in changing some of the permit requirements or planning requirements? And also, if you weren't able to be successful, what we could do to try to set up the stage to allow you to be more successful?
Well, I know in some of the community, I think Encinitas Community Plan Update, I'm going to say a couple other northern county cities, they have actually added a health component in there. So when they're looking at developing their lands. Like I said, they're looking at the walkable communities. They're looking at planting trees in places, because you don't, just planting a tree along the street makes it look more inviting, more user-friendly, Earth Day, since Earth Day was just recently. I mean, just the way they're structuring and building certain things, they're adding that as far as their health requirement. I know one thing we also wanted to try to include in there, and I don't know if it's been successful or not, was looking at when they offering permits for certain businesses, like say small mom and pop shops or liquor stores or supermarkets, to making sure that they have a certain amount of healthy produce in those stores as well. I'm not the one specifically working on that component. I have other colleagues that are, but if I get some more information on which cities in San Diego County have actually implemented, I know Encinitas was, I know Lakeside was also working on some. We're trying to work specifically with the city of San Diego in some of their updates, but they were delayed for a little bit because of funding, and I know they're trying to get other funding. But one thing that we are looking at is working with the Encanto Community Plan update and the Southeastern Community Plan update. But I can get you that information. And what can you do? Like I said, continue to advocate wherever you reside in San Diego County. And you need to talk to your community planning groups. You have a voice, and a lot of times there are not that many residents that are there at some of these meetings, and so they're just making decisions, kind of for the people that are there and looking at some of the constituents that are there, but there are really not that many residents that are there. So the more you can stand up, the more you talk to your legislatures, your city planners, your city councilmen, and let them know that, this is important to us, and that will help you out a lot in letting your voice be heard.
One of the things that people are not told is that sugar is addictive. And so they deliberately put in the sweets so that people crave it.
Right.
It's not an accident. So there has to be attention paid to how much sugar is being put into food.
On the educational department, so is there an initiative to, in addition to, the nutritional education the gentleman was talking about before, cooking education? And I say this because I think a large barrier for many people, particularly young people, is simply not having any idea how to put a meal together for themselves. I mean, many parents simply don't train their children now to cook a healthy meal, even if the ingredients are available.
I know that there are some high schools that have cooking workshops. I'm not for sure exactly what they're teaching the students, but one of our objectives is to start working in the area. We're looking, like I said, one specific area in San Diego County, but looking at offering healthy cooking workshops to residents, so that, a lot of times people cook from their cultural and what they've been taught over the years. So how can we make those same meals but in a healthier way? And so that's one thing that we're going to maybe start piloting in one area, but then they can be expanded to other areas as well.
I teach courses in culinary courses at School French, and I know we have six high schools that have these courses. And students, they're not just learning to cook, but they're also getting credit for college to take these courses in college. And that's why I was asking about getting in touch with schools. I know Gary Patel is a head of the food services department, but I haven't seen anyone contacting the teachers who teach nutrition and foods. I'm also trying to build a school garden in a school in the past, so I've done for last year.
What school are you with?
What's that?
What school are you with?
I teach at School French High School now, but last year I was at Madison High, and we're in touch with each other, all the teachers who teach these courses, and it would be nice if you came to our advisory committee, and I can invite you. It's coming up May 12th, and then we have the head of the food services department. But I also know that they have contracts they don't want to give up, with Cisco and things like that. So they're going to keep buying the Cheetos, they're going to keep buying the chocolate milk, the high fructose. Even the yogurt has gelatin in it. Why do we need yogurt with gelatin? Things like that. So how could we change that for real, not just talk about it?
Right.
They did this whole overhaul of the menu last summer, but it didn't really, to my mind, make it a huge change.
Diane, you have
I just want to say that Cisco is kind of a warehouse place with food, right? You can change what Cisco brings to in terms of reducing
Yeah.
that.